Boris Johnson promised new legislation for the NHS.
A revolution in the way we approach not just medical care but social care.
And it's quite important to know about the origins of that legislation.
A guy called Simon Stevens.
Stevens was at university with Boris Johnson.
The first elective office I ever had was at university, where the guy who helped me get elected is now running the NHS. So I'm going to work with him to see what we can do to sort things out. Where you're absolutely right is it needs reform. This has been shirked by governments for about 30 years.
30 years ago, in 1990, there was actually really quite a big seismic change in the way that the NHS was run. So they took advice from a lobbyist for a company called Kaiser Permanente in America.
To create proper incentives to reward efficiency.
Kaiser Permanente provide Medicare in America to a section of the community. What they don't do is provide a national service to everybody, regardless of who they are, which is what the NHS did.
The fund-holding practice concept owes something to the HMO experience in the United States.
So we're now actually looking at modelling the NHS on entirely different principles. The Kaiser Permanente system has had a lot of different names, and those names have been used here too. Health maintenance organisations, accountable care organisations, and currently they've been called integrated care systems.
Integrated care solutions, connecting productivity with care.
What this is a group of providers who are there to earn money, and they can be private, voluntary sector and the public sector all mixed up together, and they come together and they form a company or they form an organisation which then has a budget.
Budgetary arrangements that you would have in Valencia or Kaiser Permanente.
Which they can spend in the way that they think is appropriate, and they actually benefit from it themselves, because the less care they can give effectively, that they can get away with giving, the more money they can make for themselves.
Incentives to reward efficiency.
And that money is then shared out between the different providers.
We have a risk gain share agreement that's tripartite with the Health and Social Care Commissioners as well as with the provider.
So we have this idea to bring in these new systems, and the way to start it off is to create an internal market, so that
now the District Health Authority becomes the purchaser
rather than just being a government provided service. The Labour government came in 1997 having spoken passionately about the need to reverse the internal market and to remove the early starts of privatisation. What they actually did was they put privatisation and the marketisation on speed. They were very in love with the idea of what was going on in America.
I've been to California and talked to senior managers in Kaiser Permanente, and I think I have absolutely no doubt whatsoever that the NHS can learn from some of their management approaches.
There were some test bed sites called the Kaiser NHS beacon sites, and they took 3 large areas. They took down in Devon.
Torbay was part of the sort of pilot sites that were set up in alliance with Kaiser Permanente, who came over in 2003.
In Birmingham and up in Northumberland. And they brought Kaiser Permanente in to actually teach the NHS.
There is an NHS Kaiser Permanente partnership in 6 areas in the NHS, which are adapting lessons from Kaiser's experience in the US to apply in this country.
At the same time, they brought United Health in to teach some of the primary care trusts how to operate under the American system.
The National Health Service has entered into a contract with the American company United Health Care to pilot their Evercare system.
What the American company is providing to primary care trusts is a consultancy, a service and systems redesign service.
So we've actually had these attempts, these sort of repeated attempts at embedding a very Americanized way of looking at healthcare over quite a substantial period of time.
It should provide a basis for a continuing improvement, continuing updating in the NHS. And that is vital, because it is not something which we can legislate for once and for all and then forget about for the next 40 years.
McKinsey actually co-wrote the Health and Social Care Act of 2012, deliberately with their private healthcare clients in mind, and to open up as many possibilities as they could for the private sector. They moved the NHS out of government control into being a quango, NHS England. And very rapidly, there seemed to be a move to say that, in fact, the legislation had been disastrous and something needed to be done about it. And Simon Stevens was brought in very shortly after the Act came in to run NHS England as its CEO.
We want the NHS to be a more permeable partner for the good stuff that is going on in the innovative private sector.
If you create a system here that mirrors the American system, then you are actually designing it in such a way that means that in a trade deal there's harmony between them. And so American companies can come in much more easily. I mean, they are already here and they are already teaching the NHS how to run the process. Centene are a huge American healthcare company, insurance company. They are teaching Nottingham how to transform themselves into accountable care. Optum, who are the UK subsidiary of United Healthcare, who are here, who are also part of that process. Virginia Mason, who's an American hospital, was brought in 5 years ago to run a 5-year programme.
5 NHS trusts will from this year be partnered with Virginia Mason Hospital in Seattle.
So we've already got American companies embedded in the process of changing the NHS, and we've also got them owning some of it. The place where you can see that actually happening, coming together right now in very, very clearly is in mental health. There are probably fewer mental health beds in the NHS public service than there are in the private sector. The private sector is a very, very big player in mental health.
In Bristol, North Somerset, Gloucestershire, 3/5 of mental health care beds are owned by American companies.
Simon Stevens had been an advisor to Tony Blair, part of the team that had brought in United Health and Kaiser Permanente in to do the test bed runs and to try running the sort of the Medicare system. He had then moved to United Health of America, where he became president of the global operations, and then was brought back to be CEO of the NHS in England. He took the organisations that had been created under the Health and Social Care Act, and he started to bring them together into what are known as accountable care organisations, precisely what Kaiser Permanente runs in the United States. He's not a politician, it's not his job to make laws, it's his job to work by the law. And yet when he brought in these changes, he sat in front of the select committee and he told them,
we will kind of within the letter of the law, nevertheless act according to the spirit of what I've just described and push as hard as we can to get there without Parliament itself having to legislate. And if at some point down the line you then choose to, that would no doubt be a welcome recognition of where the health service will have moved to.
He was basically already putting things into place. And then he was suggesting to the MPs that they could bring the laws in that would be necessary to make it legal, which is quite an extraordinary thing.
Yeah, we did something pretty unusual, which is rather than just rely on the political debate to set a direction for the National Health Service, we, the National Health Service, last October, came out and said, here is our consensus point of view on how care needs to evolve in this country. And we were very gratified by the fact that all of the main political parties backed that. Without Parliament itself having to legislate.
The health service has done sort of 9/10 of what we are able to do, but the final 1/10 requires changes to the 2012 Act.
Things have really accelerated in 2021. Boris Johnson has kept his promise to Simon Stevens, and in July the bill was introduced to Parliament. It will create integrated care boards as statutory bodies. Stevens is stepping down from CEO of NHS England, and he has been made a Lord. The 2012 Act met huge opposition in the Lords, and presumably the government is relying on his presence to assure less fuss this time. Meanwhile, the Centene Corporation has expanded its ownership of GP surgeries and now has 70 of them with 500,000 patients. That makes it the largest GP provider in England. GPs will be represented in integrated care. It will be hard to deny them a place on multiple integrated care boards, given the spread of their ownership. They are now also the largest private provider of acute hospital care to the NHS, which should earn them even further representation. And their UK CEO recently resigned from that job to become the senior civil servant advising Boris Johnson on integrated care.
To see what we can do to sort things out.